The Liberals are giving out a $300,000 sole source contract to study how the coronavirus pandemic has thrown a bit of a monkey wrench into their big plans to give away drugs to addicts. And you're not going to believe the name of the organization Justin Trudeau is giving $250,000 of your hard-earned money to. Under Justin Trudeau, the Canadian government has made a drastic change in drug policy. And what I'm talking about goes far beyond just legalizing marijuana. The movement has been away from treatment and ending addictions to normalizing addictions and managing addictions. Now, often managing addiction means harm reduction, which is Liberal speak for publicly funded drugs to addicts and legalizing everything. I mean, here is Teresa wear a mask while you're getting frisky Tam saying she's open to legalizing street drugs. There is absolutely no bad advice that woman won't give you. Now, it is true that deaths by overdose are increasing during the pandemic, and a lot of that has to do with the mental health crisis being caused by the government locking everybody into their homes and taking away their livelihoods. But it also has a lot to do with the payment of $2,000 a month in CERB to addicts by the government, thus fueling their addictions. Now, instead of ending the lockdown that is causing the increase in overdoses and cutting off the money stream that is motivating addicts to consume even more drugs than usual, it looks like Justin Trudeau's government is going to try to fix the problem here by investigating how to give people more drugs during an overdose epidemic. It's right here in this sole source contract I found on the Government Procurement and Contracts website. Just look at this. Since the start of Canada's COVID-19 epidemic, unprecedented challenges in delivering primary health care, including sexually transmitted and blood-borne infection prevention and testing services and harm reduction services, have been reported across the country. These disruptions may have had a greater impact on populations that are most at risk for HIV and hepatitis, including people who use drugs. Rapid assessment of the impact of COVID-19 on access to sexually transmitted and blood-borne infection-related services, including harm reduction services, among people who use drugs in Canada. Now, according to the Liberals, there is but one organization for this job. Look at this in Section 3. Proposed contractor, Canadian Association of People Who Use Drugs, based in Nova Scotia. Only Justin Trudeau would give away $300,000 to an organization called the Canadian Association of People Who Use Drugs. Honestly, it sounds a lot like a made-up organization like George Costanza's Human Fund, but this is a real thing. A lobby group of dealers and users, I suppose. I checked out their website. Look at this. We strive to reduce oppressive societal conditions that people who currently or formerly use drugs face and emphasize the need for their direct involvement in public policy decision-making. We focus on the strengths, talents, and merits of our membership as we build a better future for people who use drugs. Okay, but wouldn't helping people get off drugs help them achieve that better future? Now let's go on. CAPUD members came together in Victoria, BC for a national meeting of people who use drugs, from which emerged our report, Collective Voices Affecting Change, which highlights key issues for people who use drugs in Canada, current actions by peer-run organizations of people who use drugs, and what we plan on doing to address these issues. CAPUD identified the need for more tools and resources on how best to include, you guessed it, people who use drugs in decisions that affected their lives, both to better prepare its members to participate and to equip organizations to better include people with lived experience meaningfully. From these efforts came the Peerology document, which is an instructional manual made by, yes, people who use drugs on how to include people with lived experience in the decision-making process that impact their livelihoods. So I guess now it's the natural default position of the government of Justin Trudeau, that's noted marijuana user Justin Trudeau, that normalization of drug addiction is the road that Canada needs to go down, instead of trying to get people clean so that they can once again be happy, healthy, productive members of society and of their own families. I guess the plan is clearly to keep people addicted, to normalize the problem, prolong the human suffering, and help addicts achieve their slow-motion suicides. And I suppose in the end we'll call it compassion. I will think of this every time the Liberals say they have no more money for our veterans. For Rebel News, I'm Sheila Gunn Reid. At Rebel News, we recognize that you cannot trust the mainstream media to tell you the other side of the story. So we will, but we need your help to do that. Now, one of the ways that you can help us actually doesn't cost you a dime. Just like and share this video, subscribe to our YouTube channel, and ring the little bell so you never miss a story.